Let's Okay, just a reminder for everybody that's new, use the member site. You'll see any new announcements or anything changes or any updates. I usually put announcements on the member site, anything you need to know. For those of you that did not receive a glucose monitoring kit with your membership, is that something new? Highly suggest to go pick one of these up. I say down here, understand this is not really appropriate for blood cancers, and I really mean leukemia. But lymphoma, yes, looking at your blood glucose can be helpful. Certainly any solid tumor, looking at your blood glucose can be helpful. And you could download a chart to keep that monitored. That could be helpful. It's not the end all be all for anything with cancer, but it's just another way to monitor the source of fuel for your cancer. Also remember that all the courses are at your access. If you've never read my book, Stop Fighting Cancer and Start Treating the Cause, you can download that free with the Stop Fighting Cancer course. The other ones that would be the most useful would probably be the autoimmune course, maybe the detox course. You have just about everything in the frequency course in the member site. Also remember to use the blog. So if you think of a question that you want an answer to right away, I might already have written a blog post about it. So look for that as well to try to save yourself some time. Okay, some questions that came in. For those that are on the call, if you have questions, you can just chat them in along the way and we'll get to them. We'll go through the questions that have come in. First question, my legs ache when I walk or have to climb steps. It does not stop me from walking and doing my exercises. My right leg, I believe, has some neuropathy as a result of the chemotherapy I received back in 2020. Could the aching indicate vascular problems? What do you recommend? So, yes, so the leg aching could indicate intermittent claudication. It could indicate some weakness of the heart. So the questions that a practitioner should ask is, and an examination should reveal, does this person have swelling in their legs? So if it's accompanied by swelling, then it's you think more of inability to drain. So that could be a function of the heart. It could also be a function of the lymphatic drainage from the leg. So, for instance, there could be a lot of problems, there could be a lot of causes of that, and it could be, let's say, if the person had, if they're older and they have some sagging of some of the intestines, putting pressure on the inferior vena cava at the iliac veins, then that could cause some swelling and leg aches. So there's lots of possibilities. Some general nutritional possibilities could range from hydration, a loss of electrolytes, so decrease in sodium, decrease in calcium, magnesium, your electrolytes. So especially during the summer days, if you're out and you're burning a lot of your minerals and you're sweating, you can end up with some mild dehydration and decrease in electrolytes, and that could be an issue too. So lots of reasons for that. You definitely want to think of a local practitioner to take a look at some of those possibilities that I discussed. But you brought up the point of chemotherapy. So chemotherapy can be an issue too, because chemotherapy is a highly toxic substance. and can settle in your tissues. Now, why do people end up with neuropathy from chemotherapy? Because of the blood flow. When that chemotherapy is flowing through your blood and it gets out into the tissues, it's harder to detoxify things from your extremities than it is from um, organs that are closer to the heart. So, and chemotherapy is toxic to neurons, so it can damage neurons. And more specifically, it's damaging the sensory receptors and the what are called the large diameter afferent nerve fibers. That's how and why a person ends up with neuropathy from chemotherapy. There is a device called the Rebuilder that we do sell in the store. It's a device, it's an FDA approved device for neuropathy, for either diabetic neuropathy or chemotherapy induced neuropathy. But also with chemotherapy, you got to think of doing some chelation work to try to pull that out if a person has bad neuropathy from chemotherapy. It's a hard one to deal with. You have the benefit of having the Ion ProWave with the right. That could be a real big help. I would say that should be your first thing that you should start with, is doing more of the Ion ProWave programs, and you can look at the general Ion ProWave programs with the right if a person had neuropathy, I'm saying, and do the clear line detox. That's been the most helpful for chemotherapy induced neuropathy. What is the best placement for my balm? Is it better to place it directly on my right breast? This person has breast cancer that was removed and radiated 3 years ago. I have been just making sure it was under the cover, but want to know if I should put the balm directly on my body. So I have always said that it's better, the closer it is to you, the better it is. But if you're using the amplifier, you don't have to get it close to you at all. You could put the bulb underneath your bed if you're using the amplifier. So if you're not using the amplifier, I think the closer it is to you, the better. Is it best to be right over the cancer? Yes and no. It's not necessary. If a person has brain cancer, we have some people with brain cancer to put the bulb right by their head. I would find it difficult to sleep myself doing that. So that's not what we typically recommend. The frequencies are strong enough, even if you don't have the amplifier, for it to, traverse your body just by putting it up near your body, and it doesn't have to be next to your brain if you had brain cancer. However, the closest to the body part of the cancer is always best, except if you have the amplifier and you could put it farther away. But if you had no evidence of disease, past breast cancer, you need to put it right up against the breast that was removed. No, I'd say putting it next to your body is just fine. Plus, you got to think, wisely here. It's like, okay, if I had breast cancer, had my breast removed, radiated 3 years ago, currently no evidence of disease, using the right to keep me that way at this point, where would you most likely get recurrence of the disease? Yes, you could get it at the site at the chest wall, but most likely you'd get recurrence of the disease in the lung, in the liver, in the bone with breast cancer. So you want it to go through your whole body. So I think you're fine if you just put it down at your tummy and you're snuggling with the bone. This drug, an oral form of 5-FU, was used in chemo and radiotherapy, and also can be considered as a replacement for IV 5-FU. It has side effects, though. This includes hand-foot syndrome. Hand-foot syndrome is a syndrome that's very common with chemotherapy patients. And it's because of what I just discussed a second ago. It's because these things are very toxic to neurons. Hand-foot syndrome, you can get these weird symptoms in your hands or your feet, in your extremities. It's not specific just to your hands and feet, but it's in your further extremities. And because it's a strong toxin, and so the question is, are you aware of natural options, perhaps homeopathy, to reduce the side effects of this oral chemo in general, or for hand-foot syndrome? So I think that your best option is to be doing the ion ProWave, because you can do that on your hands, you can do that on your feet, and it will help pull that out. The negative about doing that on ProWave is that that program can take like 45 minutes, and it's kind of a pain to do. So that would be the downside. Using some toxic chelators would be your next best thing. But you do have to be aware of the 7 phases of detoxification here, and make sure that you your body is ready to do phase 0 of detoxification, which is using a chelator to grab onto things to pull out of your body. You also have to be aware that you can't really do any heavy chelators if you have metal in your body, meaning, let's say you have a platinum plate from a fracture back when you were in high school. Can't really do that, or a nickel plate. You can't do heavy chelators if you still have mercury fillings, the silver fillings. So if you have metal in your body that way, now if you have metal in your body like a pacemaker, you're fine, because it's encased in plastic and such. So, but metal in your body that you could end up chelating could be a problem. You don't fall into any of those categories, then think about doing some heavier, like chelation type therapies. Just supporting the glutathione pathways can be helpful as well. So using now liquid liposomal glutathione can be very beneficial. Nutrients that will help stimulate glutathione, alpha-lipoic acid and glycine and some other things like that that help the glutathione recycling process can be helpful. Also eating foods that support that pathway, like onions, garlic, can be helpful for that. So glutathione is your main intracellular detoxifier, but adding a chelator helps grab onto it in the blood so it doesn't get deposited somewhere else. So if you don't have metal in your body, you feel like you've been addressing other detoxification pathways, which this person who asked this question has. Think of things like if you're talking about a chelator, that I'm talking about a heavy chelator, is our product called, it's a Cutter's Clinic product called Cheliclear. So if you do have metal in your body and that is an issue, then you have to use Cheliclear, is also called, we renamed it, it's called phase 0. And then we have another product that is Designs for Health, Metalex Synergy. And that is, the only problem with that is I think it is on back order right now. But that product is our private label phase 0 assist, because it's a little bit milder of a chelator. Than Cheliclear is. Cheliclear is a stronger chelator. So those are 2 products that you can think of that can be good. Also think about using binders in the gut too. I do explain all those things in the 7 phases of detox course too, if you want to explore that. Is Prime Protein, I grabbed a picture off the web here, a grass-fed beef isolate protein made with coconut milk powder, beet juice, and stevia, a good protein choice? I looked up, yeah, this is a good protein choice. If you have this, yes, absolutely. You could use this product. That's just fine. Remember, even this product, I think it's like 22 grams of protein. You really want to get, how many grams of protein do you want to really stimulate your immune system? Well, I don't know. Well, the answer is you want to get an equal amount of grams protein as your weight in pounds. So if I weigh 200 pounds, you want to eat 200 grams of protein a day. It doesn't make any sense to be taking that much protein powder. So you think about getting some chicken or good source beef and good salmon, and you can certainly Google a document, and maybe I could find one and put it up on the. Maybe I did. I don't know if I did on the blog post that I described this information, but so certainly don't want to be, taking it all in a protein powder. But this is great. Using a protein powder is you can gain 20 grams, 25 grams of protein by throwing that in your smoothie, and it's another good way to get stuff in. So. I emailed you recently, my found in labs, my lipids went up. The biggest dietary change for me was going on a ketogenic diet, but not meat heavy, only 4 to 6 ounces of clean beef, lamb, or chicken, heavy in fats and leafy greens. And maybe that's why lipids went up. Other practitioner suspects allulose, sweetener, not metabolized. She says it's probably fructose, and that still messes me up. Your thoughts on allulose? So allulose is a sugar substitute that is a sugar alcohol. Now, the benefit of sugar alcohol, it's thought that sugar alcohols don't increase your glucose levels. And it's been proven that they don't increase most people's glucose levels, but some people do have a sensitivity to sugar alcohols, and it can mess them up. So that can be an issue, just like fructose. Fructose is a common issue. Some people have an issue with fructose, and it can spike their glucose levels. Weird. So some people can eat, berries, and they don't have a giant spike in glucose. Some people can have a glass of carrot juice, and it doesn't spike their glucose. I had one gal who she drank a half a glass of carrot juice, and her glucose would be way over 200. And it's like she would just go get the shakes and all sorts of things. She just had an issue with her ability to metabolize fructose and glucose from vegetables like that. So some people can have issues like that, that is kind of outside of the spectrum of what would be considered the majority of people. So just be aware of that. The other thing she thought could be a factor is glyphosates. She would like to test for it. Says it affects sulfuration, cholesterol, all sulfates, redox enzymes, oxygen binding, deuterium metabolism, etc. Or do you think that increase in consuming clean meat could be driving up lipids numbers that much over 4 months? I don't think it's increase in the meats. I think it's increase in the fats that could be driving up your lipids. But I do think all these other things have an effect too. So if my cholesterol goes up, is it because I'm eating more cholesterol? Well, usually it's not. But if I'm eating a poor diet, or if I'm eating a lot of fats that I'm having that could clog up my liver, that could increase my cholesterol levels. So there's other things like your practitioner mentioned that clog up your liver. And the most common is pesticides and herbicides, and glyphosates fall into that category. Now, getting a glyphosate test done is pretty simple. So we have that. It's from Mosaic Labs. They have a glyphosate test that's a nice little test. And quite honestly, we have run a lot of glyphosate tests, and I have yet to see somebody come back within the normal limit of glyphosates. So it's really, really common, and I think it's even more common with people with a cancer diagnosis. So yeah, your cholesterol is up, your LDL C is up, your HDL is staying the same, which you want that to rise. It's not really rising that much. Your triglycerides are up, and that's really a sign of inflammation. And eating a lot more fats can be inflammatory. The other thing you want to look at too is your ability to break down fats. You want to look at your bile salts and the health of your gallbladder. So more questions really to ask, like how do you feel like you're digesting your fats? Do you feel like you have to burp a lot after you eat more fatty foods? How your bowel movements change? Do you have stomach aches because of that? What is your HCl balance in your gut to be able to break down the proteins that you're eating? Um, look at the blog I wrote about HCl and uh, um, just alkalizing or acidifying your gut. So that's really important to follow that. And there's nothing wrong with getting a glyphosate test done, though, again, this is my experience, probably going to be elevated. Additionally, regarding substitute sweeteners, she believes that once that sweet taste hits the tongue, the brain registers that and sends the signals to the pancreas to do its thing, regardless of whether the sweetener is one that is metabolized or not. What do you think of that thought process? Yeah, I do know that that is a theory that the sweeteners still affect a person because it's dealing with the brain and not so much with the chemistry of the metabolism of the product. Um, so, but understand the physiology there. So if what that could happen by eating substitute sweeteners, the 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 danger of that is you have an increased insulin production, um, and uh, and that could actually cause hypoglycemia. So it wouldn't cause hyperglycemia. So what my curiosity would be is, what is your blood glucose level, and and you could test that by, checking your blood glucose level if you have a glucometer at home, and you could eat some substitute sweeteners. Now, we're not talking about non-natural substitute sweeteners. We're talking about like sugar alcohols, not like sucralose or something like that. But and then your um, uh, or even stevia, and see what it does to your blood sugar levels. Most likely, it's not going to change your blood sugar levels. So you can look at that. But yeah, I do. And there's, like I said, there's people that have issues with sugar alcohols. And I think too many sugar alcohols are not good either. That was a huge thing when the Atkins diet was really big. We had people come in and they might lose weight on the Atkins diet, but they ended up with too many sugar alcohols because that's just pretty much was the substitute of the day in bars and things like that. And that could cause liver issues too. Question came in, no problem with eating the fats. The CRP was very low, like 0.19. Thought that was a good indicator of inflammation. Yeah, your C-reactive protein is one of your main indications of inflammation. Also, ferritin can be an indicator of inflammation in the blood too. But it's not, and CRP is not going to be specific to anything, even though there's another test called HS-CRP, which is high sensitivity CRP, which says it's a little bit more accurate to vascular inflammation. But none of them are going to be specific to inflammation in the liver. If you had a change in the fats with that change in diet, you'd still want to do some further investigation on your ability to digest those fats. And your ability to digest fats, your pancreas does make lipase, which is an enzyme to digest fats, but the majority of fat digestion is from the bile. So the bile is made in the liver, secreted into the via the bile duct into the gallbladder, and then the gallbladder secretes it into the first part of the small intestine when it senses that there's fat there. Now, if a person has issues with the gallbladder, which is very, very common, more common if you're female, then that could be part of the problem. You don't want to overlook that. Next comment was also FYI, I didn't find any site that said allulose was sugar alcohol. The one said it's not sugar alcohol, but chemical structure similar to fructose. Oh, that's interesting. Okay. So you could have a fructose sensitivity. That's another possibility too. So that's really common. I used to work with ADD, ADHD kids and spectrum kids. Fructose sensitivity was a huge problem with them. So just because you have a diagnosed cancer doesn't mean you don't have other comorbidities. So just got some blood test results back, concerned about the alkaline phosphatase and the AST. They just keep going up. I have been on a new chemo pill for the last 3 weeks and a new hormone blocker for 4 weeks. Not sure if all the work I have done the last month with these changes needs more time to work. What are your thoughts? Yeah, I don't know the data on how fast these new medications may work and how fast, if they are working, that it's going to change the alkaline phosphatase. Now, understand alkaline phosphatase and AST are can indicate liver congestion. Alkaline phosphatase but not AST is also an indicator of metastatic bony lytic destruction of bone. So if the AST went up this time, it can be an indication, and it can tie with the alkaline phosphatase, can be an indication just because of what the chemo, how the chemo might be negatively affecting the liver. And that's part of what you kind of have to go through if you're going to try a new chemo drug. I would consider increasing your coffee enemas, doing castor oil packs over the liver. That's what I would suggest to do with that. If both alkaline phosphatase and AST were elevated, I think that it can point to more of a liver issue than a bony issue. So I would increase things that are going to help flush the liver and get the liver flushed up. Make sure you're drinking plenty of water. It's a really important thing during the summer months. You don't want to be suffering from ill effects of dehydration and, think it's, and that could be a major thing. And then you think it's something other than something as simple as dehydration. Dehydration can be very serious, but it can be simple. It's a simple solution. Is there a way to stimulate the salivary glands or otherwise address dry mouth after head and neck radiation? Part of the reason I can't get back to swallowing normally is because I have such a dry mouth. Well, this is parotid gland from Biotics research. Now, I can't say that this is going to improve the function of the parotid glands, but it would be something that you could consider. So what you have a decrease in the parotid gland function, you got to build up the gland again. Is that possible? Well, it was damaged because of the radiation. So when you damage other organs due to, your cancer treatment, you got to try to build that organ back up. I would say give it a try. You have to call in to order this. You can't see it on our store site because this company doesn't allow online sales unless it's behind a curtain. My surgeon has suggested before my double mastectomy to get clips inserted into the suspicious lymph nodes. Then during surgery, she'll make sure to remove those clips along with sentinel lymph nodes to send to pathology. She doesn't like to rely on quick pathology done during surgery because she has gotten bad results before. Well, it's always nice to do it while you have the patient open and on the table, but if she's experienced, bad results because the pathology report was wrong, then I think that's a good note. She's being safer than sorry. So I think that's positive. After we see the results and whether those lymph nodes have cancer, then she do a second surgery to remove 8 to 15 more lymph nodes. She says this is conservative. And I've asked for a microsurgery to reattach blood vessels, lymph vessels to decrease chances of lymphedema. Doesn't sound like a good, reasonable plan. Well, it sounds like she's being very thorough. I'd say it's a reasonable plan. Yes, that sounds good. Part two is if there is cancer in the lymph node, she highly recommends radiation and says cancer has a 70% chance of returning if I don't. I never like it when a doctor throws a figure out like that, because this is completely rubber numbers here. So what do you mean if it's 70% chance of returning if you don't? You actually keep those statistics? I don't think so. So I have been hearing from both you and Dr. Simmons that radiation is more destructive than curative. So I have never said it's more destructive than curative, but I am not a fan of soft tissue radiation, except for something like the prostate or something like that. But doing radiation post-surgery, they're doing kind of a blanket, big swath radiation. There's a lot of things to damage around your breasts, including blood vessels and a very important organ called your heart. So I'm not a big fan of doing radiation. I know it is standards of care to do lumpectomy plus radiation and chemotherapy if you're doing a lumpectomy. And then it's standards of care used to be, it might be changing now, it used to be if you do a mastectomy, then no radiation and chemotherapy. But if you're doing a lumpectomy, you have to do radiation. Just because that's what the pharmaceutical company put together does not mean it was right for you. So, get, counsel from a multitude of people to make that decision. Are there any studies I could show them? I know I cite some studies in my book. I don't have them off the top of my head, but I don't think citing studies to your oncologist or your surgeon are going to help one bit, but could actually hurt you, because then they could have some negative thoughts about you. You just got to say, I'm not comfortable with that, I'll cross that bridge when I get there, and you can make a decision. Understand sometimes people are suggesting things because they're trying to cover their tail. So from a point of view, that from their point of view, they have to make suggestions that their clinic group is telling them to make, or they could be in trouble with their clinic group. They could lose their job. They could lose their insurance. There's all sorts of things that they have to be careful of. So even though maybe if they got cancer, they wouldn't do that. So just continue to do your research with that. If I start a round of artemisinin, would that help with bone metastatic cancer from lymphoma, and what amounts and how often? So artemisinin is an herb that it's also called wormwood. There's different varieties, but typically it's Artemisinin annua. That is the herb that's used. And it can be good for cancer. Most of the studies on artemisinin have been for viral infections, and a lot of studies for malaria. So artemisinin really I told this story before, but it's because it just makes me mad and sad when I think about it. But artemisinin is actually a wonderful killer of malaria, and it actually is an herb. It's not. It grows like a shrub, um, and it is native to a lot of areas, and one of the areas native to is Africa. And understand it, in Africa, the number one cause of death in Africa is malaria. Well, there's a wonderful drug that the pharmaceutical companies have put out to take care of malaria. So if you go over to Africa, you can take malaria medication with you, and you won't die of malaria. It's a wonderful drug. The problem is it costs about $1 a day. Well, what's the big deal? $1 a day, that's nothing. Well, to somebody in Africa, $1 a day, they literally, the average person in a lot of countries in Africa maybe make $1 a day, and they have 4 kids or 10 kids or something. They can't treat their whole family. So that's hence the leading cause of death in Africa. Well, why don't they use artemisinin? Well, the truth is, about 15 years ago, the pharmaceutical companies systematically paid people to burn artemisinin forests, and they destroyed artemisinin shrubs in the majority of Africa. That is a true story. That is sick, sad, and unbelievable, because they wanted to sell their drug. So I know of 2 humanitarian groups that are their mission is to reproduce artemisinin forests in Africa, and they teach people how to use it. So it's pretty cool. But artemisinin is a great thing for cancer too. So it's not just for malaria. It can be really good for different viruses. It can be good for different infections, but it can also be really good for cancer. Matter of fact, I pulled up this little slide that shows what it does. It decreases chronic inflammation and bad inflammation. It's a decreaser of interleukin-6, interleukin-1b, TNF alpha, and NF kappa beta. NF kappa beta is one of the very destructive inflammatory markers with cancer. Interleukin-6 is a destructive inflammatory marker with bone loss. So in that sense, so the question is, would artemisinin be good for metastatic cancer? Well, artemisinin can be good for any cancer, but the only reason why I would say, I haven't seen specific studies that say it's good for metastatic bone cancer in a sense, except that it decreases interleukin-6. This one right here, IL-6. Interleukin-6 is highly elevated whenever there's bone loss. So not just with metastatic cancer to the bone, but also with osteoporosis. So osteoporosis is an inflammatory disease. It's not because you have a lack of calcium. So it's because you have an inflammatory disorder to the bones with a highly elevated interleukin-6. Now, there is one thing that is better than artemisinin to decrease interleukin-6, and it's EGCG from green tea extract. So the T-Vigo product from US Enzymes would do even a better job than artemisinin to decrease interleukin-6 at the bone. But you can certainly, if you feel led to take artemisinin, it can be good for cancer in general. So it's a great product to take. Now understand, well, why don't you recommend that to everybody? Well, there's a ton of great products to take, and I think I don't want everybody to be on overload of products that they're taking. The artemisinin that I would say to use, I gotta find this. I gotta find it here. I'll pull it up and show it to you. Is this one right here, called Artemisinin Solo by Research Nutritionals, and I would take 2 to 3 of these a day. This, I think, is the best artemisinin on the market right now. And I've been using artemisinin for decades, because artemisinin, personally, I don't take artemisinin currently, but I've been using it a lot with Lyme disease because it's one of the great, hidden Lyme disease killers. So artemisinin can be a real benefit for that. But it can be another thing you can use for cancer. I have, in the cheek swab testing, I have a number of people that might even be on this call that are taking, and I recommend artemisinin. But it can be something that anybody can add. So, can you take the artemisinin with TV go? Oh yes, yep. We work on a little bit different pathways, but they both do decrease that interleukin-6. My AFP is still elevated, still in the 10 to 14 range when it should be below 6. Any thoughts on why? None of my doctors know why. Is it possible that 10 to 14 is my normal range? So this person has had surgery. AFP is a tumor marker, and they're wondering why debulking the cancer didn't decrease. It's decreased a lot of things, but not their AFP. So why does a tumor marker not go down when you debulk the cancer? And there may even be no evidence of disease anywhere, but the tumor marker is still elevated. So remember, a tumor, these are different proteins that are in the blood. So does it always mean if you have an elevated tumor marker that you have some sort of cancer? The answer is no. So, as a matter of fact, there is a normal range. So AFP normal range should be below 6. That means 5 would be within normal range, and a person could not have cancer and still have 5, because it's not just made. These things are not just made by tumors, and there may be an upregulation of other cells that are making these proteins after post-cancer. So it could be a neurological upregulation of other cells that are making this protein. And it's not just AFP, but any of the tumor markers. So tumor markers are just, remember, like any test, it's just one test that is a possible indicator of something going on. So you weigh that test out with comparing with other tests and other signs and symptoms. So different objective tests and different subjective signs and symptoms, you weigh that all out. Could your range just be normally high? Well, it could. How would we know that? Well, there's no way we could unless we could, jump on our time machine and go back to pre-cancer days and run an AFP and see if it is elevated then. But even that, it could literally have been what I first described, that because you had cancer, you have an upregulation of production of AFP of other cells too. So you're just making more of it. Could it be that I have hidden cancer somewhere that's not found? Could be. You just don't know. You want to do other tests. You don't rely on just one test. You don't, you just don't. You just look at other signs and symptoms. You could have something that's increasing that has nothing to do with cancer. When I sent my cheek swab, you suggested a few additions and increased a couple of the supplements you recommend. Does that mean I stay on all the others? Yes. So I'm just giving you the changes in that cheek swab test. Yes. I don't know if you evaluated everything on the spreadsheet that I sent. Yes, I did, including those from another practitioner. Yes, as best I could. I don't have all those, so I did as best as I could. Any other questions? What is an Oncotype score? So an Oncotype score is a test that's done by your oncologist to see how you would see if chemo would be a good fit for you. So that's what an Oncotype score is. So They test you against chemo, and oh, the chemo would really work well for you, based upon, I think it's a genetic factor that they look at, and they see if that would work well for you. What do I think of Fenbend? Fenbendazole is a dewormer, and fenbendazole is the name of the dewormer given to animals. We have a number of people on fenbendazole. Are there downsides of fenbendazole, using fenbendazole? Well, it is a drug. Are there downsides to it? Maybe. Have I ever seen any downsides to it? No. I've had a couple people say it gave them a stomach ache, but I don't know if it was the fenbendazole that gave them the stomach ache. I think that was more in their head. They thought they were scared because they don't ever take drugs, and they took it. They thought they had a stomach ache. You can take it with food. You shouldn't get a stomach ache with it. You're really taking as much as you would give a 10-pound dog. So if you weigh 130, 180 pounds, you're taking such a low dose of it, you really should not have any side effects of it. Is it going to deworm your body? Is it going to affect your microbiota? There's no studies that I've seen that it damages your microbiota. And at that dosage, you're probably not going to do a whole lot of deworming of you anyhow. It's a totally different mechanism that's happening with fenbendazole and cancer. And we have seen it help a lot of people. We have a lot of people taking fenbendazole. A number of you on this call may be on fenbendazole. It can be a great thing to add to your protocol. How often should I get a PET scan now? What's the best way to check for reoccurrence? Well, I think the best way to check for reoccurrence is probably a PET scan. And that would be the gold standard. The negative of that, it's about 2.5 times the radiation dose of a CT scan. So you do get a lot of radiation from a PET scan. So you don't want to do it very often. It partly depends on the person. I personally haven't had a scan now for, was it 2 years ago that I did my scan? I think it was 2 years in March that I did my scan. And it was good except for some liver lesions. And am I going to do another scan? Probably not. So that's just me. So that's just my choice. So everybody's different. Everybody has different levels of anxiety. Everybody has different levels of what they're going to do from a standards of care approach because of our makeup, because of who we are, and because of our cancer. With me, it's an easy decision for me because there's nothing that standards of care offers for my cancer. So, I mean, statistically, I should have been dead a couple of years ago. So, statistically, it's a 7% 5-year survival rate. I'm at 6.5 years now, I think. So, yeah, I'm not going to do another scan. Even if my symptoms get really bad, I'm still not going to do another scan because there's nothing they can do for me. But you have other options with breast cancer, so maybe you would do another scan, and you might have different levels of anxiety that you're struggling with things, and to get another scan can be helpful and to relieve that anxiety. So, is there damage that could occur because of the radiation of the scan? Sure, but you just got to weigh out what's better for you emotionally, to know that you're doing well, or and deal with the radiation and detox that and support your body through that, or to not. So everybody's got to weigh that out. So it would be okay to take the artemisinin solo with the TV-Go from Mr. Absolutely. Yep, you can take those together. There's really no, honestly, Mark, you're not taking an excess of stuff, so you're fine. But there's some people that are taking 100 different bottles of supplements, not from my recommendation, but they're taking a ton of stuff because they're going to multiple practitioners, and adding another thing is probably not wise. So you don't fit into that category. What is a grade? I've seen that mentioned by women in a Facebook group. Nobody has ever given me my grade. So there's you could Google search ways that they measure severity of different cancers. They've changed the way that they measure breast cancer in the last 5 years. So, but not all oncologists use those measurements. So you could Google the different ways that you measure the severity of different cancers. I think I might have written a blog post about it a while back, but I can't remember. Maybe it's in my book. I can't remember it because we don't go over that. So my questions sent yesterday. Did you send questions via the? So if you have questions that you send in, then make sure that you send them on the member site. I pulled all the questions off the member site, so maybe send those again, and we'll get to those next week if you can't think about typing them out. Is mebenzenol the same as Fen-Phen? Yes, but it's the human drug for that. Would Rife therapy affect the stent in my kidney and ureter? No, not at all. So the frequencies, so if you were doing electrical frequencies, you could have effect of the stent, but not light frequencies. So electrical frequencies, you like doing a PEMF. You have to be careful with stents. Well, partly depends on how much PEMF you're doing on a daily basis. And you certainly have to be careful if you had a pacemaker. Couldn't do it near the pacemaker. You really shouldn't do PEMF at all if you have a pacemaker. But to Rife, there's no contraindications for any metal implants. And when I did mention metal implants before about chelation, stainless steel stent is not considered a contraindication for chelation therapy. Is it okay to use Rife frequency for parasites and Candida daily or 2 to 3 times a week? Sure, you can do it every single day. If you don't have parasites and you're running parasite frequency, not going to do anything. But if you have parasites, you're going to kill parasites. Now, the parasite frequencies and the Candida frequencies, could you kill too fast and cause issues? Not really. Where you could kill too fast and cause issues using the Rife machine is if you're killing gram-negative bacteria. So what would gram-negative bacteria be? Well, mainly the most common is Lyme disease, Borrelia burgdorferi, the gram-negative bacteria for Lyme disease. Well, why is that bad? Because gram-negative bacteria have lipopolysaccharides in their cell wall. And when you kill gram-negative bacteria, you liberate lipopolysaccharides, and lipopolysaccharides stimulate an immune function and immune stimulation. And if you already have autoimmune issues, which many Lyme patients have, they get what's called a Herxheimer reaction, and they can get really sick. So that's the only negatives about using the Rife is if you have Lyme, you don't want to try to kill too quickly. There isn't, if you're running, any other frequencies like that are non-Lyme programs, you're going to be just fine. My oncologist said that my cancer could also change from hormone positive to negative, trying to get me to do a biopsy again. I would totally agree with you. Matter of fact, I can't tell you how many women that will start with us and they have hormone negative, so they have triple negative breast cancer, and then we test that just in our cheek swab testing that they do well with a DIM or something like that. So I don't believe all those pathology reports personally. So regardless of whether your cancer switches to hormone negative or hormone positive, That would just be, I think your oncologist is just concerned that they want to switch a therapy. So they want to change a drug. So if you're on a drug slash chemotherapy with the oncologist, that's based upon you being gram positive or gram negative, then maybe testing is in order for them. But we've had patients too with multiple breast lesions and biopsy different breast lesions, and one comes back gram or hormone positive, and one comes back hormone negative. So that's why I don't always trust those pathology reports. But if you're not doing, if you're not currently doing chemo, or you don't plan on doing chemo, you're not doing any of the medication, what does it make a difference to them whether you're hormone positive or negative? So that would be my concern. How legit or non-legit are meridians and chakras physically and spiritually? So meridians are just energy pathways that are used by acupuncturists. So an acupuncturist is looking at different acupuncture points that are along a meridian. Now that's different than a chakra. So meridians are energy points on, or acupuncture points are on different meridians that are energy pathways. Now, it used to be, I used to have to say, about 25 years ago, that they're not measurable, but they are measurable now. You can actually measure those energy pathways. That is very physical, and there's nothing spiritual about that. So acupuncture is not a spiritual technique. It's not a religious technique. And there's no reason for Christians to not do acupuncture from a spiritual standpoint. Now, it might be a reason to not go to an acupuncturist that's a Buddhist or something like that, but the practice of acupuncture itself is not a spiritual practice. Chakras are a little controversial because that is a little bit different, and that can be very spiritual. So I don't like to talk about chakras myself, so I don't discuss chakras, and that is not measurable. Now one would say, oh, you could measure energy on the chakra. Well, that's really just on that specific meridian. So I don't buy into the chakra thing. I think it's used by New Agers, and I'm not into that. And I think that can be dangerous from a spiritual perspective. I do believe that as a believer, you could be protected from all of that, and you don't have to worry about those things. But I do think we're supposed to use wisdom and not open ourselves up to practice occultic practice. So I would stay away from that. Have you ever used advanced TRS, 100% nano zeolite for heavy metal? Yes. So we have multiple products with zeolite in them, which can be extremely beneficial. Zeolite is a chelator. Now, understand, zeolite isn't really well absorbed. So a lot of people classify zeolite as a binder, but depending on how much you take, you are absorbing some zeolite, and it can be a good chelator. So it's a good product. Zeolite, we have a number of products with zeolite in it. So with all the turmeric and glutathione, etc., that I'm taking, I'm still getting the inflammatory side effects of the hormone blockers in the drug. Most notably, the arthritic feeling in my hands and wrists. It's hand and foot syndrome. I guess I have to just deal with it for now. Or did the ClearTox, ProBioClear, and Adaptive Clear you recommend help? So the ClearTox will help with that. The ProBioClear, no. The Adaptive Clear, no. The ProBioClear is a probiotic. That's a gut-brain probiotic. It's a new one out that I'm really excited about. The Adaptive Clear is an adaptogen. But the problem with using, you're trying to detox your body at the same time as you're toxifying your body, it's a battle. It's a tug of war that you're dealing with. So you just got to keep doing as many things as you possibly can to keep yourself clean. It's been maybe 18 months since you did a last cheek swab for me. That's a long time. So probably should probably not wait more than about 6 months, but you're doing well. So I was ready to send one in when the medical police said you couldn't do them anymore. Oh, yeah. Yeah, well, we don't have medical police on our back for that right now. Oh, by the way, the reason why the the video for the last week's Zoom call had to be put up as a video on our member site is because the video police were after us. So funny, it's hilarious. So it's hilarious and depressing at the same time. So we got a warning, our first strike from YouTube. 3 strikes, they take your whole channel down. So we might lose our whole channel. Same thing that Mercola got. Why? Because we posted something about cancer. Well, their AI hasn't picked up all our other videos on cancer. The one that they picked up was hydrogen peroxide for cancer. Not so fast. It actually says you shouldn't take hydrogen peroxide for cancer. Oh my gosh, unbelievable. So again, it's not a person that's actually looking for this. They just have AI, scrubbing the internet, and we got a strike. And so I couldn't post anything on our YouTube channel for 1 week. That was the penalty that I got. I was in YouTube jail for 1 week. So we had to put it up that way. So we're looking at different ways to get, the videos up there. The benefit of YouTube is that they have that YouTube player, so that I can put it into that category and you can watch all the videos that are our Zoom call videos. And we can't find another video company that has that same thing. So frustrating. So yeah, we got docked our strike 1 from YouTube because we had a video on cancer. So yes, we do retest it. We could retest for all those things. We can just start from scratch and retest everything. I do want you to send in the form on the member site that goes along with the Cheeks one, please. Okay, I have terrible insomnia. It started when I went on antibiotics for staph. I have not slept more than 4 hours in a 24-hour period, usually like 1 to 2 hours in the last month. It takes forever to get to sleep. Okay, so you might be experiencing some what's called pain or PANDAS, which is not uncommon after a strep or staph infection, because it can affect your brain. Because it could cross the blood-brain barrier. Look at my video on brain inflammation. If you search the blog brain inflammation, that will help, because what that could do is it could cause microglial priming, damages the microglial cells, and you have that inflammation in the brain. And I give in that video what to do for that. It's really just high dose lab, what to deal with that. I missed most of the Zoom call. It will be posted as soon as I possibly can. Levaquin gives me insomnia. I'm not very familiar with that drug. So do look at the blog about and search brain inflammation. I think that will be helpful. All right, with that, we'll bid adieu for the day. Thank you all. Know that I'm praying for all of you, and I'll get this video up. If I can't post to YouTube, I haven't tried the last couple of days. I think we're all out of YouTube jail. But if I can't post to YouTube, I'll get it up on the member site just directly. All right, love you all. I'm praying for you, and we'll see you next week.